It is my absolute pleasure to be talking with you today. I'm here with Dr. Sarah Arshad,
Hmm.
and I am just enthralled with what you do for a living. And I can't wait for us to share it with our listeners.
Thank you so much for having me. I feel very honored to kind of be here and being able to talk to you.
Yeah. So to get started, can you just give us a little introduction of who you are and the work that you are doing in this world, and then we'll uh, go from there.
Sure. It's so funny. I think the how I answer the who I am can change so drastically.
For sure.
Like every day, I bring a little bit of a different part of myself. So I think it's relevant to say I'm the daughter of immigrants.
Hmm.
And that said, my mom, came to this country as a medical doctor and then did
Mm.
a social pediatrics residency and worked
Oh,
in a federally qualified health center doing primary care pediatrics.
okay.
So you might see a connection with some of what I do
I was going
now.
to say I'm starting to already see
You see the
genetics
big
and
picture.
epigenetics in action. This is exciting.
Yeah.
Yeah.
And my parents are from Pakistan, and then they moved to the United States after they got married. I'm the middle child, so
Okay.
I have an older brother and a younger sister. And then I currently practice child psychiatry
Hmm.
in both an emergency room setting and a consult liaison setting. So when kids are admitted to a medical hospital, I can see them there. I also work on what's called an access line. So a lot of states have programs called access programs
Hmm.
where a primary care pediatric provider can call on a phone and then, within 30 minutes get access to maybe someone who can help with care coordination for certain patients,
Wonderful.
as well as, get a child psychiatrist on the phone to at least run a case by and
Yeah.
sometimes do some virtual consultation.
Oh,
I
how
will add,
great.
I'm also a board certified pediatrician
Yeah.
because I did triple board training.
Oh my goodness.
So
Yes.
I don't directly practice
Yes.
pediatrics anymore, but
Okay.
I think I indirectly use a lot of that learning
Mhm.
and those skills and kind of the other everyday work that I do. And I would
Yes.
be amiss not to say I aim to be and think of myself as a cultural psychiatrist.
Oh, yes.
And it's a term I'm still getting a little bit more comfortable. So I am a member of my professional organization, which is the American Academy of Child and Adolescent Psychiatry.
Yes.
And then I've been a longstanding member of, we have a diversity and culture committee. Um, and I think to me, what being a cultural psychiatrist is really delving into, what makes each kid, each family uniquely them,
Mm,
kind of
mm.
like where they're
Yes.
living, what their generational stories are,
Yes.
and you really the impact of wherever they are culturally, and a lot of different demographic factors, who that makes them, and
Yes.
then how that leads them to maybe talking to me.
Yeah. Wow. That's fantastic. And as I say that that's fantastic, part of the reason that I say that is because oftentimes within our health systems and those of us who practice, we don't have a lot of training
Hmm.
or recognition and understanding for the cultural aspects that people bring into our offices or the emergency room or the hospital. So, can you help to kind of unpack that even
Yeah.
further? How important it is to focus on culture and know the cultural identity of the people we
Yeah,
serve.
absolutely. And again, it's something I continue to grow. And, I worked with our organization on, creating a curriculum. I'm a big proponent of within the DSM, there is an appendix called the Cultural Formulation Interview,
Okay.
which is just a toolbox of very regular, everyday questions. I
Yes.
think to inspire anyone to have a polite curiosity about who might be in the room with you today.
Yes.
I
Yes.
think people make a lot of assumptions about who has culture and who doesn't. I'm
Yes.
like,
That's right.
everyone has a cultural background.
Yes.
And I think just being able to acknowledge that, we bring so many elements with us, even
Yeah.
as I was telling you who I am, right?
Hmm.
You wouldn't have known I'm the daughter of immigrants or that my
That's
mom
right.
was a primary, right?
That's
And
right.
yet I bring all of that with me.
Yes.
And it's a part of who I am, how I describe what is going on with me, how I live my everyday life. And I think, in medicine, we are appropriately focused on a lot of what we can objectively measure. And I
Yes.
don't think we have as much ability or maybe time or really training in how to delve into some of that subjective matter. And I think it's interesting because I think of us as psychiatrists as the people who can talk about anything,
Hmm.
right? And I do a lot of suicide risk assessments.
Yes.
So if I can talk about suicide, I should be able to talk about anything in a room.
Really good point.
And you know that there are a lot of people who feel very uncomfortable asking about, socioeconomic demographic factors, someone's potentially religious or spiritual identity,
True.
someone's, racial identity.
Yes.
And even beyond that, right? I think there's areas of this country that have very strong identities. So I trained in Pittsburgh, and there was like a coal mining identity to some of the families I
Mhm.
was seeing that was
Yes.
entirely foreign to me,
Yes.
who, was born in the Bronx, New York and raised in New Jersey, right? I didn't understand what that meant.
Yes.
And it was such a part of them and who they were that it made sense just to ask them about that.
Absolutely.
There's also a group of patients who are kind of 4-H,
Mm.
dairy farming, middle of Pennsylvania folk, and I didn't know anything about that culture either.
Yes.
And it made a lot of sense to say, wow, what is this like for you now? What did it used to be like? Has that changed?
Yes.
Because that is a part of maybe their somatic symptoms or their depression, their anxiety, or maybe it was a matter of this is how they knew to approach care, or maybe what some of their concerns with even engaging in any care were.
Yeah. Very, very, very important points.
Yeah.
Are there any stories that from your past you can share with us today that really are emblematic of the importance of understanding the culture. You shared generally
Yeah.
the different cultural
Sure.
subtypes and importance, but I'm wondering, oftentimes in my career, I have specific people who have
Yeah.
taught me something, and I truly carry them through the rest of my life. I'm wondering, anything come to mind for you?
Yeah. I know, recently there was, a young girl who I was very worried about. And it took a long time for family to even wrap their heads around the fact that this child might be depressed
Okay.
and that this might have been, her second suicide attempt. And
Yes.
I think it was just so uncomfortable for them to even admit that that could be going on. They felt like if that were true, if their kid was depressed, it was because they had failed as parents. And
Mhm.
so then there was a lot of work in talking about you can be an excellent parent and your kid might still have some symptoms of depression, right?
Yes.
It it doesn't
It's
it doesn't one doesn't negate the
yeah,
other.
no, that's beautiful.
And I think their concerns with even engaging in mental health care were, these were people who maybe had not been treated well by a variety of systems in the past.
Yes.
And so I think they were bringing that concern and that stigma and that fear with them,
Mm.
and even engaging with me on the possibility of what might be going on with their daughter here and now.
Oh, thank you for sharing that
Yeah.
that story. You mentioned I heard the term stigma, and as an addiction medicine physician, psychiatrist, that's an everyday piece of the work that we do. And similar to what you were saying, there needs to be that recognition that no matter what I'm bringing into that room, stigma and a sense of judgment is often present in that room.
Yeah.
And education, training, helping people to be aware is important in the world of addiction.
Yeah.
I know that much of your career is spent in training and education from that cultural awareness perspective.
Yeah.
And I'd love to hear how you're approaching not only your own personal development, we are all continuing to learn,
Yeah.
but how are you also striving to teach others?
I think those are a lot of good questions. I will say in my own background, right? My family is from Pakistan. We are South Asian. We're Muslim,
Yeah.
and in some of those, say, cultures, right? You don't you don't admit to these symptoms. These symptoms are, they're just you don't talk about them.
Yes.
You instead focus on how grateful you are for things going on in your life, or maybe if you're sad, should you be praying more, turning to God, those kinds of things.
Yes.
So I think there's a lot of clarification. And even kind of how I ask some of the questions when I'm taking a history is in also providing, psychoeducation,
Hmm.
in terms of saying, there are some people who just, genetically this is happening in their bodies, this is what they're feeling, or they have life events, and then this is kind of what's going on, and it doesn't mean they're not truly, strong faith believers or they
Yeah.
have this other cultural identity, and we can still be very grateful for the things we do have in our life and still manifest with these symptoms. And so I think for it's important to have us take our time. And I think that's the biggest thing that my biggest gripe with the healthcare
Yeah.
system now is I think the people who are providing medical care, just we don't have the time with the patients
Very true.
that we would want,
That's
right?
true.
I think we would all at least
Yes.
love double the amount of time.
Mhm.
And part of the reason I actually do, emergency room and consult liaison work is I can maybe have some more time, right?
Mm.
If I know there's not another patient I need to see, I can spend longer in this room, or I might be
Yes.
able to plan my day out so I can spend a little bit more time in
Yes.
having some of these conversations. Or again, if a kid is admitted to a hospital, I might be able to have some conversations over the course of a week,
Mhm.
that I may not have in another area. So I think
Yes.
my own building my clinical structure so that I have some of that time to just, I think just sitting and being with the
Yes.
people with us is something that's
Very
very
important.
hard.
Yes.
Um,
Very important.
and I notice this now that I have a toddler because every time she cries, the adults are like, "Oh, it's okay, it's okay."
Yeah.
I was like, "She's a toddler.
Yeah.
She feels like she's in distress, and maybe her tantrum is because she wants more cheese." And I'm
Yeah.
saying no. And I'm not going to tell her she's okay because she doesn't feel okay.
That's
But
it.
I can sit with her.
Yes.
I can try to read her a book instead. I can try to, give her some skills to help in her current,
Mm.
emotional state.
That's right.
And I can be with her, right? And I
Yes.
think as a parent, you try to make that time for your child. And I think in the professional setting, we are, sometimes built in these 10-minute, 15-minute, 30-minute
Very
blocks or
true.
chunks.
Yes.
And then we don't feel like we have that time to sit and be.
Mhm.
And so I think that's what I try to teach when I teach my trainees some, cultural humility.
Yes.
I say just try to sit and be with the people in front of you and hear what
Yes.
they're telling you. And
Yes.
I say that because we ask questions and we're writing stuff down, but we're already thinking about the next question to ask. We have our differential diagnosis
Yeah.
set. We're already thinking about what we might need to order for them. Will their insurance cover it or not? We've
Yeah.
already thought 5 steps ahead.
Yeah.
Those 5 steps are taking us away from the person we are just literally sitting here with.
Yes. No, very true. Very true. I also am struck with there is certainly the need to listen, actively listen and hear,
Yeah.
as you were saying. But there's also a need and an importance for when you hear something to be able to recognize and understand its import.
Yeah.
And I can just speak personally that growing up in a society that many of the systems and the healthcare system and health education essentially purpose built for someone like myself.
Yeah.
And you mentioned earlier in our conversation that oftentimes people will not even recognize and acknowledge culture as something that is important. And I have observed in myself and in others more similar to me, that's often the norm.
Yeah.
That because we have been majoritized, we don't see culture in the same way that you are talking about it right now. I'm wondering when you are faced with that, and it's pretty prevalent in our health systems. What is your approach to beginning to help individuals to understand the importance of what you are talking about so that if we get around to actively listening,
Yeah.
because I feel like that was some of the difficulty in listening and not taking the time, is
Yeah.
if I don't know what I'm listening for,
Yeah.
I'm not going to listen for it. So I'm just wondering your approach.
Yeah. And again, I will come back to I remember my the psychiatrist who taught me how to do motivational interviewing.
Yeah.
He was this Frenchman. He's like, "Sarah, you need to have this polite itchiness, this curiosity to understand who is sitting with you."
Yes.
And so then sometimes I'm like, if this was a person I was just getting to know, happen to, you know, I don't actually like talking to people next to me on the plane,
Yeah.
but let's say it was someone with me at a coffee shop and my goal was to get to know them.
Yes.
How would I approach that if I wasn't thinking, say, with my doctor brain?
Mm-hmm.
And then
Yes.
again, you want to know where they're from, how many siblings they have,
Yes.
what did their family do, what did their grandparents do,
Yeah.
where they're coming from, what are their thoughts on, values on life. That is all a part of who we are and kind of what we bring to the table.
For sure.
And again, we see, we get concerned when people maybe aren't agreeing with our medical decision making. And it's very easy to say, well, they're not trusting the science. But how much are we understanding where they're coming from? And
Yes.
so I think it's a little bit of swallowing our own egos.
Good point.
Dr. Sarah doesn't know the right answer in all the scenarios. She may
Yes.
know what, the science and the evidence basis and the algorithms tell us is the next step.
Yes.
But how do I know that next step is right for this kid and this family in front of me?
Yes.
And I don't know that until I know them.
Sure.
So then I can ask them, I'm saying a lot of things. How does me even talking about depression, anxiety feel for you? And so, again, I do a lot of suicide risk assessment. So sometimes when I tell parents, hey, we're talking about some serious stuff, how does it even feel that we're talking about your kid and whether or not they just had, a suicide attempt?
Yes, yes,
Allow room for those feelings
yeah,
because they may not have even insight into their emotional response. And it's
absolutely.
absolutely colored by who knows what's been going on in their personal lives and their generational histories.
Yes,
You have to give them room to allow for that. And then you
yes.
have to be open to kind of the responses that you get.
Yeah. Oh, what a gift. I mean, truly, what a gift to give people that space to be who they are and then to really know they're being seen and heard. I mean, that truly,
I don't know if
that's
I
not
do it all
common.
the time. That is
Yeah.
my goal. My
Well,
goal is when someone sits with
yes,
me.
yes,
And I love when they look at me and they're like, "You get it." And whether it's
yes,
because I've nailed some of the symptoms that they're having,
yes,
or whether I go to a parent and say, I was just with your kid for 20 minutes. You're with them for 15 years.
yes.
My gestalt is your kid is has this type of temperament, is really, hard on him or herself because of this, and this is what's really going on with
Yeah.
them." And they're like, "How did you?"
Oh,
And I was
yes.
like, I asked them and I listened.
Yeah. That's amazing. That's really fantastic. Now, I also am curious what you've seen in terms of health systems falling short of providing appropriate culturally specific care, especially in the work that you do, child and adolescent psychiatry and pediatrics. Where do you see the gaps and where our systems are falling short?
So many gaps.
Yeah,
I think people are really trying to do good work. And again, I'll go
yeah,
back to
for
I
sure.
think where, if we as the direct frontline clinicians are being mandated to see X number of patients, it really diminishes our time
Yes.
with kids and families.
Hmm.
So I think that's kind of the easiest. If I don't even have time to understand where the kid or the family is in front of me,
Yep.
it's going to take away my ability to do so.
Okay.
I would say second, it's so fascinating to me how culture is even defined.
Mm.
And so some people think, oh, like, Sarah has culture because she's clearly, brown and wears a
Yeah.
hijab. Steve,
Yeah.
you don't have
Yeah.
culture.
Right. No,
And
that's yeah. I
I
yeah.
once had to have a conversation with another colleague and say, this family has culture too. And they're like, oh, but they're, white rural American
Yes.
farmers. I'm like, exactly. There's so
Exactly.
much cultural history there.
Yes.
And they're like, oh,
Yes.
they're refusing this care. We don't know why. And I was like, I think you need to understand
Yeah.
more about them.
Yes.
And so I think that people feel like there's siloed of who gets to say they have culture and not. And the reality is everyone has culture.
Yes. Yes.
I think how we used to do cultural training is we talk about, how to treat this population and that
Hmm.
population in very siloed,
Very
segmented
much so.
ways.
Yes. Very much
I
so.
think that's not the current way we do things. And so I
That's
think if you look
exciting.
at kind of cultural humility, I think it's really looking at everyone is bringing a lot to the table.
Yes.
How are we understanding whoever it is that's in front of us
Yes.
and how their different identities are intersecting and,
Yes.
enmeshing? And
Yes.
so I think even refocusing on everyone has a culture, how are we getting to know them? This is
Yes.
something we should not be doing with certain kids or families. We should be doing this with everyone.
Great
Um,
point. That a critically important point. I can again just responding from a personal standpoint. When finally beginning to recognize and appreciate cultural aspects in everyone and having a degree of cultural humility, it's almost equivalent to when I first started to wear glasses.
mhm.
You see things entirely different.
Literally, you have a
Yeah.
new lens
You'd have a
on
new
life.
lens, perfect point, which is why it's so exciting to be talking with you, someone who your professional
Mhm.
career is grounded in cultural psychiatry and looking at how do we put systems in place that target the very real disparities that exist across our system. Champions such as yourself, it's exciting to be able to talk with you. Um, I know what was it, 2024? I think you actually published work specifically on the disparities within systems and looking towards solutions, if I'm not mistaken. Is that
Yeah.
correct?
I have a couple of publications. So I think,
Yeah.
on the spectrum from, using the cultural formulation interview to really come across cultural formulations of kids and families.
Yeah.
And like I said, it's important to think that everyone has a culture and a lot of them are hidden identities, right?
Yes.
I told you I was the mom of a 20-month-old.
Yes.
So a lot of what I'm bringing
Oh,
to
for
the
sure.
table in all of my encounters when people ask me how I am,
Yeah.
I tell them how my kid is,
Ah,
right?
yes.
Which you
Yes.
wouldn't visibly see on me, hopefully, unless I'm like covered in some yogurt or peanut butter.
Yeah.
But right, that's a huge part of my identity now.
Yeah.
So I think
Yes, it is.
understanding that. And
Sure.
again, so I think understanding those hidden identities we won't ever get until we ask.
Yes.
And then we have to look, now that we're understanding that everyone has these visible and these invisible identities that they're bringing to the table,
Yeah.
how have some of those identities been treated historically? We
Yes.
have systems in place, and I love that. For the pediatrics work is kind of fun because there's so many layers that should be supporting kids and families, and oftentimes they do. The primary mental health system, sorry, the primary medical system, the school system, and then again, we have these other agencies, right? We have the foster care system. Sometimes there's a juvenile justice system, and
Yes.
then we have to think: Are they were all made with the greatest intentions of supporting
Yep.
kids and families, having
Yes.
everyone do well, but is that how they are working?
Yes.
And so,
Great
unfortunately, we
question.
see that in certain populations, that is not how they're working.
Hmm.
So, the easiest example is the school system. There's a lot of great work for a lot of kids, but I think there is data now that, especially young Black boys are more often to get, say, punishments.
Hmm.
And those punishments and detentions and suspensions might lead actually to a higher dropout rate.
Sure.
And now it becomes, a perpetuating problem where then if young Black men are dropping out of schools more often, what does that mean for, their ability to live long and good and productive lives with
Sure.
everything else if now they have this limit based on the fact that they, are high school dropouts.
Yes. Yes.
And there's other, there's certain groups that maybe are more likely to be separated, say from parents and kids when the foster care system or the DHS is
Yes.
involved.
Yes.
And again, I think again these agencies were all built to try to help build people together and keep families together, and really make them get people across the finish line to live successful adolescence and adulthoods.
Yes.
It's not working that way for all different populations.
Yes.
And right now, I think we're seeing that, people in rural America are really suffering.
Yes.
Literally, the healthcare providers are not there.
That's correct.
I'm going to tell you about the
Yeah.
silliest psychiatry note recommendation I ever wrote.
Okay.
It was from a family from a certain county in Pennsylvania, and they had an autistic son. They loved him very much. They really wanted in-home services.
Yes.
He was approved for insurance from in-home services. Those in-home services did not exist in their county.
Yes.
So I wrote a note saying my recommendation was for them to move to a different county
Oh my.
where those services
Where they
existed, right?
exist.
Because we talk about all sorts of barriers to care, and
Yes.
some of them can be insurance barriers. This barrier was literally those providers didn't exist where this kid,
Yep.
this family lived.
Yes.
And we see that, and I think more and more often where,
Yes.
you know, nowhere in the country has, enough services. And
Yes.
at least in like at least some cities, some of those services at least exist. In areas of rural America, they don't.
They do not. No, that's a very good point. And especially with child and adolescent psychiatry services. I practice in Minnesota. A lot of the work that we do is with rural Minnesota, and the most difficult situations are in children and adolescents who need either psychiatric care or psychiatric and again addiction care.
Yeah.
There are no resources. Um, which kind of brings us to something we share
Yeah.
in common is a passion for how do we help and equip rural primary care, rural pediatrics in being part of a solution to
Yeah.
that limitation. So, talk to us a little bit about how you came to be co-director of the UC Irvine Train New Trainers Child and Adolescent Psychiatry Fellowship.
Yeah, I would love to. It's funny because I mentioned my mom was a primary care
Yes,
pediatrician at a federally qualified health center in like the inner city Bronx for
exactly.
majority of her professional career, and she is now retired. So I think working with pediatricians is something I was drawn to. So when I was in medical school, even deciding what kind of doctor I wanted to be,
Yes.
I heard about these programs called triple board programs.
Mhm.
And so I applied. And so it's a 5-year program. I did pediatrics, adult and child psychiatry.
Yes.
Um, and I realized I wanted to work more with people in primary care
Yes.
because they are the medical homes,
Yeah.
right? Peds has this beautiful history of kind of prevention and, talking to families about how to raise healthy children, how to be good parents, how to, live fulfilling lives. And
Yes.
so I wanted to encourage that. And I recognized that in my pediatrics training, I really was not getting a lot of, mental health
Mm.
teaching
Sure.
training. So I knew how to do that because I had separately done my
Yeah.
residency and fellowship.
Yes.
And so then I wanted to get more involved in, educating and working with primary care providers. And again, as a cultural psychiatrist, I recognize that many youth, whether it's because they're, rural and they literally don't have a child psychiatrist in their county,
Yep.
or maybe it's, a certain racial minority, urban youth who just feel a lot more comfortable in their medical homes,
Yeah.
they will go to their primary care provider. And so I was like, we have to help these people who are taking these kids and families on really feel like they can do the best job that they can.
Oh, I love
And
it.
they didn't get their training back when they did their residency or when they did their training. So, how can we help? And I
Yes.
actually came across this program at one of my national conferences, the American Academy
Oh,
of Child and Adolescent Psychiatry. And
yes.
I actually just like signed up and
Did
then had
you?
a meeting with
Oh,
Robert and
that
Melissa. And
yes.
then they
Ah,
asked me to come on board, and I've been very excited to do so ever since because,
oh,
again,
that's
there's so
fantastic.
many amazing primary care providers out there who are
Isn't that the truth?
really doing
Yes.
their best. And
Yes.
if I can help them, I can, for me, the impact is so big because if I
Yes.
can, train 10, 20, 30, 100 people a year, all of the kids and their families hopefully are getting some benefit by what I've been able
Yeah.
to teach them. So it makes
Yes.
me feel like I have this bigger impact.
Oh, that's fantastic to hear. Your passion comes across so
Huh.
readily, so readily. As we think about the barriers, some of the limitations, this as a part of the solution. I don't want to end our conversation though without really intentionally looking at for you individually,
No.
where do you see light and where do you see hope in today's world? I think currently for me, it's personally really important to be seen with hope and light. And I'd love to know, where do you draw yours?
Yeah, I think there's a lot of chaos
Yes,
going
there
on.
is.
That's the easiest way I
Yeah,
can describe. I think we all have moments in our daily lives that bring us those elements of joy.
yeah.
One of my family therapy supervisors is like, Sarah, whenever you find something good, you need to find a big fat yellow highlighter, highlight that.
Mm,
So in my personal life, it's when I get home from work, put my phones literally away, and
yeah.
I'm with my kid and my family.
Yes.
And for my patients, I kind of tell them, what do you guys do together that brings you? There's a lot of stuff going on. I know you have these other symptoms. What do you guys do collectively that brings you joy? Wow, that's
Yeah.
incredible.
Love it.
Highlight that.
Yeah.
Can we do more of that? As the chaos is going on around us, I don't have the power to change a lot of those things.
Yes.
I have power in my day to day. And again,
Yes.
I come with a lot of
Mm,
privilege and I have a
yeah.
lot of, abilities to have the time to spend with my kid and put stuff away. I
Yeah.
only work, the jobs and I have some off time.
Yes.
And so within the power of what I can do, I can choose to do things that are warm and
Mm,
joyful that bring me just so much positivity. So I
yeah.
encourage that for myself
Ah,
as well as the kids and the families that we see. If we can highlight more of those good interactions
yeah.
they have the ability to do, and maybe it's just reading stories together, playing board games, watching a funny video,
That's
right? If we
fabulous.
can do more of that in our individual lives, right,
Yes.
the collective benefit, I think, will grow.
Ah, that's beautiful. That's absolutely beautiful. As people listen and get to know you
Yeah.
through this conversation that we've had, I am positive that there are going to be people that want to learn more. What are the best ways to learn more about you, the work you do, and the organizations that you're a part of?
Yeah. So I think I'm obviously a member of the TNT
Yeah,
team, and so
yeah.
I think for any primary care folks who are interested in this training, certainly reaching out and seeing if this would be a good fit for you is a great way. And then I will say I have my professional home is otherwise the American Academy of Child and Adolescent Psychiatry,
Okay.
and there's so many different ways of getting involved. And even if you're not a child psychiatrist, and I think it's a really open and welcoming group. And I think some of my committee meetings there are really special. Child psychiatry is a pretty small field. You can
Yes.
find my email address. You
Okay.
can email me.
Very
You
good.
can do that for probably almost any child psychiatrist. I'm sometimes surprised at some of the bigger names who've responded
Oh,
immediately as
fun.
I sent them an email. And I
Yeah.
think there's a lot of people who are really trying to promote good things. And I think we're for the most part pretty excited to be able to
Love
talk
it.
to folks.
Love it. Before we close, any last message that you want to leave our listeners with?
Yeah, I think I appreciated you asking me what brings me personal joy. And so I think focusing on that each day intentionally, make that a priority every day, like have this big checkbox. I did something that brought me joy today. And make sure you do that, right? Because it's so easy as a parent, as a medical provider, as a this, that, and the other, right? We let all these other identities take over and we don't do that small bit for ourselves
Very true.
where we need to. And it needs
Yeah.
to be that first big checkbox that we do
Great
um,
reminder.
to help us then be more in everything else that we're trying to do.
Yeah. Now that is a good place to end. Sarah, I knew this was going to be a great conversation. Thank you so much for taking time with us to share who you are, what you do, and how you see the world. I really appreciate you.
Thank you so much.
Yeah. Take care.